Well, if you've caught any of the programming here on WFTS this month, you know that we have partnered with some great teams around the Bay Area and around the state to really drive home the message that even though the pandemic may be looking like it's nearing its end, we know that there are a lot of people still suffering from anxiety and depression. And we really want to make sure that you know about resources that can help. And one of those great resources, we're going to have us join us this morning from Humana, Dr. Elena Stepter, the medical director of behavioral health. So good to see you. Good morning, doctor.
Hi, Carly. Thanks so much for having me.
Yeah, so there's a lot to talk about here this morning. And again, we just can't talk about it enough because I still think for whatever reason, there's this stigma and people get worried about, saying it out loud that they're dealing with anxiety or depression. Have you and your team been seeing that, the numbers continue to rise?
It's funny that you mentioned that. Yes, at Humana, we definitely have seen an increase in the number of people who are accessing mental health resources now. And I think it's related to a number of factors. For some, they actually contracted COVID-19 and experienced significant illness or are still experiencing symptoms for it. For other people, I think it's related to knowing or witnessing someone who died from COVID-19. Then there's the loss of employment, there's the loss of income, there's the families who had to work from home while taking care of their children and helping with virtual learning. So I think a lot of those factors contribute. But I think for the vast majority of us, we've been socially isolated for so long that now we're having this, what I call re-entry anxiety. So having to make the decision to go back into the workplace or to send our children back to school, or even just to go out to dinner or do the things that we used to do before in public events, it's really anxiety provoking now. So I think it's a combination of things that's really leading to the increase in the number of people reporting depression and anxiety symptoms.
Well, my first thought when I hear you say that is, okay, if they're reporting it and if they're looking for resources, that's a good thing, right? We want people reaching out and asking for help. It's okay.
Mhm. Definitely. That's exactly what I tell people to do. First and foremost, we really want you to just tell someone, let anyone know that you're experiencing some symptoms, because a lot of times it can help to either validate what you're experiencing and help to normalize, because we're all going through things, or it can help you to realize that maybe this is a little bit outside of what's considered to be normal, and maybe I really need to reach out and seek other behavioral health services.
So let's talk about some of those symptoms, I guess you would call them, or what are some of those red flags that you say, you know what, this has maybe gone, a little too far or a little too long?
Right, so that's a great question, especially with May being Mental Health Awareness Month. What I tell people to monitor is three major categories. So first, you want to look at your emotions. Am I worrying more than usual? Am I more fearful than usual? Maybe am I more sad, depressed, anxious, frustrated, irritable? Am I snapping more at family members, friends, coworkers? Then you want to look at your physical symptoms. So am I having difficulty falling asleep or staying asleep? Am I having more difficulty concentrating? Am I having unexplained physical symptoms like fatigue, headaches, stomach aches, back pain, muscle tension? And then last, but definitely not least, and to me, probably the most important, is behavioral changes. So am I having more interpersonal problems with family members, friends, and coworkers? Am I avoiding certain situations now, like not wanting to go to work, not wanting to go to school, not wanting to re-enter society and go to public events? And am I using substances maybe or alcohol to cope when I really wasn't doing that before?
Yeah, man, we've been showing the website as we close here, just a couple seconds left. What's that first step that you want to encourage people to do as we close?
Again, first step, just let someone know. It could be like a friend, coworker, pastor, primary care doctor, just anyone. It doesn't have to be a therapist or psychiatrist, first of all. We really just want you to get that information out there and let someone know that you're going through some things. At Humana, we really try to remove all those barriers to accessing mental health care. We don't have referral systems. We've increased our telehealth services. So we really just want you to seek out the information. I always also recommend people going to the National Alliance on Mental Illness website, or NAMI, because they have tons of information and a lot of times can provide you with resources specific for your community.
Dr. Stepter, thank you so much for your time. We really appreciate it. Again, they're WFTS.com /not alone as well, where you can get more resources.